Hi, I'm Suhina, CEO and founder of Jonda Health and a founding member of the INSEAD Emerging Markets Group. I will be your host today on the second episode of the series, Emerging Markets Post-COVID-19, What Does the Future Hold?, where we will delve into what will healthcare look like post-pandemic. Today, I'm joined by two amazing panelists with a world of experience in healthcare in emerging markets, Chris and Sejal. So over to you, Chris and Sejal, if you wouldn't mind introducing yourself.
Thank you, Chris. I guess this is ladies first. Thank you, Suhina, for the kind invitation. I'm really looking forward to this discussion. I'm Sejal Mistry. I'm the Regional Director of Access Health International, Southeast Asia. Access Health is a nonprofit organization that really focuses on health system strengthening, health financing, and fundamentally answering the question of how do we get medicine and healthcare to the people who need it. Over to you, Chris.
Yeah, and likewise, thanks for the opportunity, Suhina, and great to see you, Sejal. So I'll just take slightly longer on the intro, just because happy, later on if people have questions about my own journey, just personally and professionally too. I thought that is a kind of important part here, and I have various kind of roles across the ecosystem. So one of the things I do is I serve as a partner at Pureland Venture, which is a VC stage health tech company. So I do a lot of the value creation work there, meaning working with startup companies located in Asia, but also abroad as well. And then I am a member of KPMG's Global Health and Life Sciences Center of Excellence. So similar to Sejal, working on a lot of the kind of health access and quality and affordability challenges. And then I'm a member of the APAC Med Digital Health Committee, so shaping the regulations and reimbursement pathways of digital health in the region. And then finally, I just kind of help the Singapore ecosystem with some of the kind of innovation curriculum in the healthcare space too. So lots of activity there. Maybe just quickly on kind of a personal level too. So I kind of grew up with a lot of physical and mental trauma, I guess you could say. So I fractured my spine at a fairly young age and still have metal plates, today, and just kind of always marveled at, medical innovation and have lost family members to mental illness too. So I'm very kind of acute to that. I've lived in different geographies around the world. So I really enjoy kind of learning what works and, different elements of culture and philosophies behind health systems. So I really appreciate that. And maybe just a final plug for FemTech. I'm really into FemTech. I got two daughters who are kind of aspiring in that space. And then some of the best founders I work with, I think, are the kind of FemTech leaders. So anyway, whether it's on this podcast or later, always happy to interact with all of you out there and answer questions. So sorry for the long.
No, that's perfect. We're so happy to have you both. So thank you for agreeing to be on this session. So let's get things started. So as we know, COVID-19 really kickstarted a whole new age of flexibility. During the lockdowns, all industries at some point needed to really pivot towards this virtual model, really transforming how we work, how we buy groceries, and more importantly, really how we seek care. I mean, we've seen, unsurprisingly, the amount of pressure the pandemic has placed on the capacity and resources within hospitals and clinics. We've also seen the crisis as really having impaired patients' ability and desire to physically attend clinics due to social distancing requirements and staying at home. I mean, all of these challenges ushering in really a new age of flexible healthcare that enables the industry to provide care and support really in numerous formats. Similarly, I would say probably to omni-channel retailers. We've really seen healthcare systems around the world act urgently to change regulations, reimbursement models, and really the way care is delivered. So what are some of these key changes that you've seen in the ASEAN region? And maybe we'll start with you, Sejal.
Yeah, thanks, Suhina. I think you laid it out really nicely. And I think there's a lot of devastation with COVID-19, but there has been a silver lining, I think, in the healthcare space. And that's really good. That's really about making good on the promise of having patient-centric care. and health systems that are responsive to patient needs. And all the trends that you just mentioned, whether it's on retail, on commerce, that's happening in the healthcare. These are innovations that have already happened in other sectors where people are expecting a good, seamless experience, and we just haven't had that in healthcare. I think COVID-19 has changed that, and for public health reasons, safety reasons, people needed to go digital. But once the healthcare industry had to force themselves to kind of go along with the digitization trend, I think we're starting to see a lot more of that convenience, the affordability, and the quality that's coming through those means. So within ASEAN, I think places like Indonesia, Vietnam, Malaysia, Thailand, you really see an uptick in teleconsultations. But beyond teleconsultations, we're also seeing things in the health financing front, having insurance that can be personalized, customized to people's needs, and in a way that's simple, easy to understand. And I think all of these things are really positive for healthcare in the region.
Right. No, very true. Chris, your thoughts?
Yeah, sure. I think, first and foremost, as Sejal kind of alluded to as well, I think, unfortunately, the pandemic exposed a lot of the ugliness that still does exist in this industry and the inequities that we, still have a long way to go to resolve. So let's not kind of kid ourselves in that perspective. But I do also agree that, there's been a lot of opportunity for us to reflect, reimagine, and invite new stakeholders to the discussion who previously may not have been part of it, whether it be telco companies or transport companies, or many others who are kind of stepping up in the healthcare space. And we could talk maybe more about that later too. I think, when I look at the technologies, I try to kind of lump them into three buckets, because healthcare is a very laggard adoption industry. So I look at technologies that, may not seem that fancy or sophisticated, but are things that were much needed anyway, just simple improvements in the health system, like maybe appointment booking software, or, SMS text to people to, to nudge them on their journey. And then also, obviously, a lot of the topic happens around, new models of care that are born through technologies like teleconsultations and telemedicine. And then there's still, I think, that third bucket out there of just all the futuristic stuff that, may or may not materialize, whether it be augmented reality or 3D printing. There's all these kinds of things too that are still not quite mainstream, but floating out there. I thought, Suhina, it was interesting that study, you guys did looking at Indonesia, because the number one kind of technology that people were most interested in during COVID was actually about getting healthcare information and kind of rating systems. So when I saw that, I had kind of two reactions. One is, that's great that people are taking a greater interest in the quality of their care, but it just, again, shows you that sometimes it's about the simplicity of the solution and not something so fancy or sophisticated. I think later in your study, it said something like people are averaging at least three digital health tools already per person, which is probably starting to get pretty overwhelming, right? So I think just kind of in summary, most of the technology that I'm involved with these days is either one in the hardware plus software space. So this is definitely kind of the name of the game these days. Or two, in what I would call like contactless care, meaning it's all evolved around the way that we do things without having to come in physical proximity of one another or even doctors. So that's what occupies most of my time, I would say.
No, I think it's a really interesting time for healthcare, and I think one of the other areas I think that we're seeing changes too is in terms of regulations and reimbursements, particularly also in and around digital health. And I know that in some situations, some of these changes have been temporary, or they've just been for that period of time during the pandemic. And so as we look forward, I would say, to a post-pandemic world, which changes do you see as temporary, and which ones do you see as permanent and really changing for the better? And how are they helping to address some of the long-term issues within the healthcare sector?
Maybe I'll take part of that, and probably more on the permanent changes. It's a little bit hard maybe to predict. I think there's been a lot, I think particularly the areas of teleconsultation and bringing sort of services to the home that is here to stay. But what I think is really interesting about COVID is that it was almost forced a regulatory sandbox onto countries. So what we have is a period of trial and error, and really working out how to use these tools in a way. So I think it's not maybe binary where teleconsultation is now in or certain tools are now in and then it will be out. I think it's going to get refined because we are learning, after the initial hype, how do you think about reimbursements, as you mentioned? How do you think about standardizing the quality of care that's still delivered online? How do you prevent fraud and other things? So I think this is a good sort of real-time, real-world experiment that's happening that will refine these new technologies and models. And I'm at a loss to sort of think of what's going to stay or what's going to drop out. But I'm hoping that governments are really collecting these data points to see what's working and what's not.
That's well said, Sejal. And I think from my side too, oftentimes people throw regulation and reimbursement kind of together in one string, and there's actually quite a big chasm there. I mean, there's lots of innovations and technologies that are true, but not financed, and they can just die a slow death. So I'm actually a little bit more optimistic on the regulatory side of things. So we've been working a lot with different countries around the region to improve the way that they assess these new technologies. And there's a kind of standard framework that is being used in terms of different dimensions of regulation and how they keep pace with technology. And generally speaking, across the region, the countries have done a good job of the way that they qualify and classify the new technologies. For example, distinguishing between a medical device or a digital health tool. I think where a lot of the countries still have ways to go is alternative pathways that they can offer, meaning possibly an expedited review if it's a technology that doesn't need such thorough investigation, and also on their AI and ML frameworks. That's kind of the name of the game at the moment, is getting some of that beefed up. On the reimbursement side, yeah, I mean, on one hand, it has been good progress, but a lot of it is the temporary coverage aspect. It's interesting when I talk to different governments about expanding out the reimbursement kind of models for different technologies. What they're actually have been telling us is, use the existing charge codes and reimbursement schemes that already exist, and then just work locally at a kind of hospital or doctor level to have them swap out the tools that they're using, right? So it's almost kind of a passive way to adopt new technology. But, if that's the name of the game, then you got to do it. I think the other area within reimbursement where we're trying to drive a lot of progress is the way that technologies are valued. Because today, through health technology assessments or other tools, it's very rigid related to pharmaceutical or kind of traditional medical device products. But we need more creativity for new technologies that may bring additional values like user experience or improvement to workflows or data privacy measures. So we're trying to kind of expand out the value by which the reimbursement frameworks work. And I would just put in a plug here for APAC Med. I mean, I mentioned earlier, kind of I support some of their committees, and there's a lot of discussions and good multi-stakeholder things happening in this space. If anybody out there wants to sort of get more involved in that.
You're great.
One point that Chris made, Suhina, I was just thinking this through with your question. I think one area where we're going to maybe see some realignment or increasing caution is in the area of data ownership and privacy. I think as a lot of services and tools are going online, I don't think we've yet come to comfortable ground on how to handle patient data, sensitive data, with the risk of cyber breaches and things. I think it's a sort of a sticking point for health systems. And if we go very fast digitally, I think there has to come a point where we start resolving, some fundamental questions about ownership, privacy, the tools it takes to sort of maintain the ethics, but also, allow for convenience and innovation to happen.
No, I mean, I think that's great. I think you guys have already started to talk about some of the big challenges I think that the industry will face, and I couldn't agree more with regards to the issues around data privacy and security. funnily enough, the startup that I'm working on, which is still in stealth mode, is actually playing exactly in that space. So hopefully I can share more about what we're trying to do in that space in the coming weeks and months. But if we were to take a step aside from some of the clear data privacy issues and challenges, what do you see as some of the other challenges that the industry is going to face as we move forward?
Chris, do you want to give a go?
Sure. Yeah. Like I said earlier, I think while there is a lot of optimism related to new things that we can do coming out of the pandemic, it does replace the fact that the system is still fundamentally broken in a lot of ways. And I always tell the innovation companies, like, technology just makes a bad process work faster, right? So you can't just kind of slap on all these shiny, fancy things and just expect the healthcare system to transform overnight. So I still think there's a lot of groundwork to be done, and sometimes the innovator type profiles, whether they be academics or doctors, don't always, I think, have a full grasp of how everything is working along the pathway. And so that kind of remains a challenge in just how you scale up a good idea. I guess the only other one I would add here too is, I think while there's a lot of rhetoric around how we've increased collaborations as a result of the pandemic, even competitors working together and producing vaccines and all kinds of amazing innovations, getting things to market. I still think that there needs to be a lot more from a kind of technology innovation side of things, thought process around how to make a lot of these systems interoperable. We talked earlier about people maybe having already 3 digital health tools. They all connect. There's a kind of joke about wearables, and you just imagine the future of the patient is covered in from head to toe in devices, right? So that's not really the desired state. But I guess part of my commentary about collaboration comes from a lot of the founders I work with in the early stage companies. They're very anxious about big companies and competitors, but I think in the end, it's just, we're gonna have to find a way to all do this together, because it's not working to just constantly fight each other over market share and try to squeeze each other out and deal with these competitive forces. I would still like to see a lot more collaboration happen.
I think for me, Suhina, and putting on especially the role of Access Health is with the penetration of digital and all the benefits that come along with it. I think we just have to make sure that, like with all our health interventions, that digital interventions are equitable. And we run the risk of exacerbating a digital divide that is present, whether it's within populations of countries or across countries. So making sure whether it's rural, remote, or otherwise vulnerable populations are really part of the sort of the development of the technology and system. So a lot of digital interventions might be focused on capital cities or tertiary hospitals, but getting it to primary care, getting it to remote locations. It's digital that allows it to be possible, but we have to make sure that we are truly being inclusive about it. So that's one thing that I would say let's put on the horizon. The other thing I would mention is along the lines of again, data ownership, privacy, access. I think we're going to start seeing sort of the correlate to bioethics. I think we're going to start seeing more discussions around cyber ethics. I think we need those discussions, not to sort of say, technology is good or bad, but what are the parameters as a society? What are the limits? Because right now there's an enormous amount of convenience, but there is a lot of risk that comes with it. And I'm sure Chris might have some thoughts on this when we look at machine learning, AI, et cetera. So I feel like cyber ethics is going to be a topic that more and more people will be talking about in years to come.
I was just going to add one thing that I thought Sejal was really interesting. It always makes me kind of wonder, when you see these surveys and studies that say 70-something% of people prefer, to have a digital health kind of intervention than say a traditional pathway. But I always wonder in those studies, so who participated in that study? It means they could read and had access to a technology to answer the survey. And I always kind of wonder how big of the picture we really see in terms of the challenges that are ahead. So I thought it was well said by Sejal there. Yeah.
Yeah, I mean, and I think, you've raised a good point there. I think, in the study that we did, by Makan last year in Indonesia, actually, the population that was surveyed was the online adult population in Indonesia, right? So by default, they would have needed to have access to the internet, and that then skews the demographic to being people who are more in urban areas than those that are not, right? So yeah, I think that's always a challenge with some of these studies. I mean, looking particularly at that study, which was done last year, we saw that at the peak of COVID-19, 35% of Indonesians used telemedicine, of which 77% actually did so in the last 12 months. So, I mean, it's quite clear that digital health has really accelerated thanks to COVID-19 being a very necessary catalyst. And so it would be great to hear your views as to how you see telemedicine evolving, particularly in this region, if at all, as we look ahead post-pandemic.
Maybe I can start with a few, I guess, reflections. I think teleconsultations and telemedicine is a wonderful tool during COVID. And I think when you need sort of medical intervention, a SNAP, but I think there is still a significant portion of the population in Southeast Asia, and I'd say in most places, where they will want that physical interaction and contact with medical professionals. And what we might start seeing is a somewhat of a hybrid-based approach, where maybe an initial screening is teleconsultation, and then again, it takes you down that care pathway for a physical interaction. So for me, I think, we're just kind of getting started on what a telemedicine model looks like. I don't think it will stay as is. And, healthcare is just one of those areas where you really can't take out that physical component. It's not just about doing that physical exam. So, you know this, it's about, building the trust, the relationship. It's a very intimate process. And I think having a screen in between patient and provider is takes away a lot of that intimacy, essentially.
Yeah, well said, Sejal. It's very true. As a physician, I can completely relate to that. It's also very difficult to do a consult on screen versus in person. I know I would struggle to do it, but it requires a different skill set. Not that it's not doable; it's completely doable, as we've seen. But I definitely think that there is something to be said about doctor-patient relationships in continued managed care, as opposed to having different doctors for one patient for a particular condition. It becomes more challenging.
Yeah, I think from my side, there's a lot of buzz on the topic, but it's not necessarily new, right? And I always thought the kind of I'll just use the term telemedicine for now, but I always thought that was kind of the shame of the health system, that it wasn't more heavily utilized before, especially in geographies where it so clearly resolves a lot of issues. But I think part of it too is terminology. I mean, here we say telemedicine, but I see different words thrown around. Really, X, means different things, right? I mean, you've got the telehealth side of things, the kind of proactive preventative interventions. You got telecare, which is more the kind of reactive, responsive elements. I mean, oftentimes I use telemedicine when looking more at kind of e-prescription or ways that people actually interact with the medicine part of the value chain. You have teleradiology. I mean, there's so many sub-elements, actually, not all the same. They serve different purposes, different pros and cons. So I think part of it too is just the way we use words. But, personally speaking, I think it's all moving forward and we're not necessarily going to go backwards. I don't know if it'll be as standalone as it is today. I think ultimately it's going to become integrated into either other care pathway steps or just other players who are going to come in and just say, I just want to own this, aspect. I was just having an interesting conversation the other day with a taxi company, and they wanted to convert part of their fleets to be like mobile teleconsultation units, right? So, I mean, there's a lot of kind of different companies eyeing this space. The other kind of aspect of this that I think needs some further discussion, just going back to not only technology, but just the way the health system works, is oftentimes in the design of these kind of health for all programs, we use the primary care model as the kind of gatekeeper model. And there's just so much pressure nowadays on primary care and, healthcare worker burnout and the specialisms that it requires to effectively diagnose conditions. So I do think it's kind of interesting to reflect on the models we've had previously, let's say a primary care-led model, and could some of that be more futuristic with the tele tools? But just like Sejal said, I mean, I think keeping the human touch is key here, and not kind of forgetting that aspect. Maybe the only thing I was going to mention was I think one thing that's kind of gone a little bit by the wayside during the pandemic is medical tourism, and that's actually a pretty significant part of many developing country economies. It's kind of a controversial area in terms of the benefits it brings versus the local populations it overlooks. But again, I think there's opportunity here potentially to use more tele-consultation type tools to get kind of medical tourism back online a little bit as well.
No, absolutely. I mean, I think there's going to be interesting to see how actually the space evolves. I definitely think that we're going to start to see more integrated plays rather than standalone solutions, in my opinion. But I guess we'll wait and see. But I guess as we're talking about the future, I would like to hear what your top three predictions are for healthcare in the short and long term.
Go ahead, Sejal.
Oh, I was just about to bounce it back to you. Okay, well, I think I might not come up with three. I don't think I've quite quantified it. I think one is really, again, the trend that we're seeing. I don't think we're going to move backwards from digital access and healthcare services. I think we're going to see more and more of that happening, and maybe even the commoditization of health services and packages. So, it might not be traditional health partners. I think you're going to start seeing more incumbents that are coming in that are not in the healthcare space, that are starting to offer components of healthcare, as Chris mentioned, teleconsultations. It can be certain healthcare products, insurance, et cetera. So I would predict that there's going to be a lot newer, unexpected and newer actors in the healthcare field. I think we're going to see more of a digital force going ahead. And then I would say my third thing is there's going to be perhaps some regulatory breaks put in when it comes to data ownership and data privacy. I suspect that at some point something's going to go wrong, and regulators are going to start taking a hard look at sort of the rapid acceleration without the sort of the guardrails in place.
Yeah, some positive and then some things to watch out for. That's a good way to approach that question. I think on my side, I kind of did this YouTube series thing during the pandemic where I was just speaking to different people around the world, about what was happening, trying to get a picture of what the future could look like. So that formed my views a little bit. But yeah, I think my three things are, so first of all, just the incredible opportunity we have with the rapid improvements in health literacy that have happened globally. And of course, there's still the risk of misinformation, et cetera. But I think the average level of health literacy has gone up quite a bit, which, a lot of legacy health policies always kind of stopped at what the individual level behaviors were, and just lack of education information. So I noticed in the report, Suhina, that you guys did too, that people, for example, in Indonesia are feeling more responsible for their health and kind of willing to pay for elements of what they need. So just as Sejal said, I think that's going to create lots of new opportunities and kind of companies and new profiles to kind of come into this space. I think the second thing is, there was a lot of discussion about healthcare passporting, and it got kind of hot there for a while and still exists, but it's calmed down a little bit. But in my opinion, we just have basically touched the tip of the iceberg on the intertwine of kind of like social mobility and health status. So the idea that our health status is so readily available and is now part of the way we get on a plane or show up to work. I mean, the possibilities there, how that transforms the putting health status as a forefront and all the testing that you need, and just the information sharing. I mean, I think we really haven't thought through the full implications there, and it would be interesting to see kind of what direction that takes. And then lastly, I would just think, there's the old adage, health is wealth, and we saw during the pandemic the intertwine of economy and health. But I think it goes even further, and now people really should question the value of their health system and how it's designed and what it brings to them. And just as an example, I mean, typically countries are ranked as on a percentage of their GDP that they invest in healthcare. But I mean, you could argue that going forward, does that even make sense? I mean, was GDP going to grow forever? And we see some of the best, most efficient health systems that spend much less than other developed countries, right? So I think this whole concept of just the value of a health system and how it's designed and what it means for us as individuals, there should be a lot more discussion on this topic, I think. So that's it for me. Over.
Yeah, maybe we need to have another podcast then, Chris, on that topic in the not too distant future.
I would really love if someone could kind of hack that, and just totally break apart, because a lot of us who work in this space are just so bound by the old ways, right? So it's like someone needs to come in and just totally hack that and destroy it and rebuild it,
Destruction instead of disruption. I like it.
Yeah, sometimes it's always good to start with a clean slate in some ways, right? But thank you guys. I think it's been a really great discussion. It's also great to connect with both of you. It's been a while, so thank you so much. It's been great having you on the Emerging Markets podcast, and thank you guys for listening.